Hello, Namaskar. I am Dr. Sagar Javle. I am the inventor of this therapy called as transcranial electrical current stimulation of the brain with a device, and for which I received a patent from the government of India a year ago. And now the 20 years protection will remain, during which buying or selling this device or using this device without my permission will be illegal. Please take a note of that. And please subscribe to this channel, press the bell icon button so that whatever new videos I make shall reach you immediately. In this particular video, what we are going to discuss is the role of this transcranial electrical stimulation device and therapy for the psychological condition called depression. Now, depression is an extremely common disorder, so common that it is said that by the age of 40, there is no person on the planet who has not experienced depression. It is that common. Now, this treatment of this condition is usually drugs, and they have limitations because these drugs, they have a lot of side effects. The effect is also present, I am not saying that, but what happens is that the brain is a very intelligent organ, so it blocks the drugs coming from outside and makes them useless. That's why almost no drug whatsoever used in depression or in psychological condition is proved to be strongly beneficial than placebo in any of the drug trials, because this is the basics that the brain wants to block it. The strongest psychoactive drug is cocaine, which is million times more powerful than antidepressants. The brain within 7 days develops resistance to cocaine. Cocaine becomes coconut water in 7 days. That is the power of the human brain. In this particular therapy, what we are using is electricity. Now, brain is an electrical organ, so it cannot develop resistance to electricity. Otherwise, it will simply shut down. Brain works only on half a volt electricity. Developing resistance means instead of half volt, it will take 3 volts, then 10, 20, then 220, and maybe 1000 volts. So that is impossible. The brain is still working because it's an electrical organ. So when we use electricity to modulate the brain has to surrender because it cannot develop resistance to electricity. This weakness of the brain we have encashed in this particular therapy. That's why the therapy works so well, much better than the drugs also. But drugs are, after all, they are FDA approved, they have legal protections. I won't advise you to stop drugs for depression directly or immediately or without the notice of your psychiatrist and doctor. So please consult your doctor, your psychiatrist, take the person into confidence, and we are not against any psychiatrist or any medical treatment, of course, and use along with the drugs initially. Then slowly reduce the dose of the drugs, and some of you may be able to go off the drugs completely, we don't know, and some of you will remain on drugs but on the lower doses. So all varieties are possible. Let us not blame anybody. So in this therapy, I will specifically tell you what are the specific position of the electrodes, the frequency and the duration of the therapy. The therapy's basics and the basics of the machine and its demo, a specific very detailed video is made and a link put in the description box below. You should see that first and then come to this video only for the specific role in the disease condition called depression. So what is the basic pathophysiology in depression is that both the brain hemispheres, the left and the right, they are not synchronized with each other. They are like two different individuals. So it becomes just like a split personality. One going in one direction, other going other direction. It's like step brothers. They don't talk to each other. They keep fighting with each other. That creates distress and problems. So what the therapy does, it synchronizes both the brain hemispheres. So in other language you can say the two step brothers become the real brothers. They speak to each other, they coordinate, they synchronize, and the operation is very smooth, and the distress is gone, and this distress is responsible for the depression. This is a very modern, new, and one of the additional hypotheses of depression. There are other theories like neurotransmitter theories and other theories. I am not saying it is wrong, but this is an add-on on that particular thing. So if you are deficient of neurotransmitters, this therapy won't replace that. So you have to take the neurotransmitters, its precursors, its vitamins. I am not against it, but what a drug therapy cannot do, that this therapy can do. So this therapy can be an adjuvant to the existing therapy of depression, and not necessary and total alternative. But in few patients, who knows that they may be totally able to get away with the drugs. I already said that. So the center of our emotions is the amygdala, the right and left amygdala and the hippocampus. The right amygdala and the right hippocampus are located in this spot, but inside, about 5 centimeter inside. If you make a hole from here up to 5 centimeters, somewhere here is your amygdala located, behind the eye somewhere. So no electricity can go to that place, it is deep enough, but the amygdalas are connected to something superficial called the temporal lobes, which are very superficial, just above the ears. So what we are going to do, we are going to modulate the temporal lobes, and from there the amygdala and hippocampus are going to get modulated automatically. It's like I am the boss and there are people under my control, so somebody has to control them, you control me directly. So if I am under your thumb, they automatically come under your thumb. It's like that philosophy is used, because for modulating the amygdalas you need to put electrodes. It's not socially acceptable. Billions of people have depression, you are not going to put electrodes, and how many times will you put? You need 30 sessions, you need 50 sessions, you need 1 or 2 sessions per week for the rest of your life. How will you manage that? It's not possible. So that you can do with this particular therapy. That is the beauty of this therapy, that the drugs cannot synchronize the brain, then drugs have resistance. The therapy does not have that resistance, and a drug cannot specifically stimulate or inhibit a particular brain area, but a therapy can. So that is the beauty of this particular therapy, that suppose I want to only stimulate this part of the brain, no drug can do that, but this therapy can. That is the beauty. So these head straps are given to you, you have to wear it like this. You take the electrode, on the black surface put ECG gel, spread it well, otherwise it will act only on the area where the gel is present. Spread it well on both the sides, and this is the exact location of the electrodes, just above the ear on both the sides, on the temporal lobes, under the head strap. Okay, so that is the position of the electrode for depression. And the second location you can use is stimulate your frontal lobes, like this. So this is the second position. Because the frontal lobes secrete lot of things, like there is a nucleus accumbens here. So when the frontal lobes are stimulated, the nucleus accumbens is stimulated. That is the brain's reward center, pleasure center. It secretes a substance called anandamide. They labeled it as Ananda. Ananda means bliss. The ancient yogis used to tell that this particular spot called Agya Chakra, and this particular areas when stimulated they feel bliss. And now the reason is known, is the nucleus accumbens, some 5 centimeters from here, one on both the sides. When you stimulate the frontal lobes, the nucleus accumbens on both is stimulated, that produces anandamide, plus the brain produces dopamine, and dopamine is what makes you blissful. So you are eating the raw material of dopamine, which is L-tyrosine. The brain converts L-tyrosine to dopamine and you feel happy. So that is the thing. So brain is kind of depressed, brain hemispheres are disorganized, not synchronized, amygdalas are not synchronized, that is the cause of depression. So one electrode position is this, take few sessions here and few sessions here. What should be the frequency? About 10 cycles per second. That is the alpha range. This is a relaxed mind, a happy mind, free of the 6 enemies called Kama, Krodha, Mada, Moha, Matsara, Ahankara. As we learn in yoga and spirituality, you will become a wonderful person who will be free of all these things. Once the brain is synchronized, the brain falls in alpha rhythm throughout the day. And throughout the day, you are going to feel good, positive, and free of all 6 enemies, as I have said. So, kind of a spiritual person, a nice person, that is the goal of everything, basically, whether science, religion, or whatever. Both the amygdalas will get synchronized. There will be balance between positive and negative. Brain will be synchronized, brain will be activated in the alpha range. Don't use more than 10 cycles, because excessive stimulation can lead to anxiety and depression itself. So in fact, your brain is excessively stimulated, maybe because of this modernization, and rather than just stimulated, it is disorganized. So left and right brains, they act like step brothers. So they will become real brothers after synchronization, and your depression will be gone. So that is the whole idea. Then the duration, 30 minutes, start with 30 minutes, increase 10 minutes, go to 90 minutes per day, once a day, twice a day. Once a day is enough for 3 months. It will take 3 months to have results. You can continue for the rest of the life. After 3 months, you may do twice a week for the rest of the life, or you may decide the dose and duration as per your disease condition. Even healthy people can do this, because all have depression, all have problems. Our hormones are reduced, neurotransmitters are reduced after age, as we age. So this can be a treatment even for healthy people with cognitive decline of the aging process. So not necessarily, but could be of great help for the patients of depression. But as I already said, do not replace the drug therapy immediately. Take your psychiatrist into consideration, into confidence. This is a scientific therapy, this is not some quackery. There are publications on that. And with the coordination with your psychiatrist, then you reduce the dose, or who knows, if you are lucky, you can get away with the drugs also. Okay, so I think we have discussed enough about the role of this therapy in depression. Now refer this video and website to all your patients with depression and make it viral. In the description box below, I have given my personal phone number, my WhatsApp number, my email address, and the website. On the order page of the website, there is a link where you can buy the device. Currently device being shipped only in India. From outside you can pick up from India. So we'll ship in India on any address, you pick up from there. So that's all. And about side effects, there can be burning at the electrodes. It reduces by reducing the intensity. So keep intensity between 3 to 5, then the problem is over. Second is, there could be some nausea, very rarely vomiting, but is over within hours. No separate treatment may be necessary. And there can be mild headache at times, that's all. There are absolutely no side effects. It's a very safe therapy and it has a lasting effect. The drug's effect lasts only till they stay in the blood. The therapy's effect can easily last for few weeks, even for few months. So that is the beauty. So everything we have discussed about the role of therapy in depression. Thank you very much.